So diarrhea is really common in dogs. 9 out of 10 cases will resolve with just a bland diet at home alone. If your dog's still happy, eating, and there's no signs of vomiting, it's probably not a serious case of diarrhea. The first thing that we can do at home is to fast your dog. Normally I recommend around 6 to 12 hours. Any longer than this, it's too much, I think, and especially if your dog's small or very young, then I wouldn't recommend to fast so long. I also recommend using a bland diet. So I normally recommend boiled chicken and boiled rice, as this can really settle the guts. I recommend to use this until 2 or 3 days after the diarrhea has resolved, and then gradually mix back to the regular diet. Worms can cause diarrhea. Although they are uncommon, we do recommend that all dogs are up to date with their deworming. This should be every 3 to 6 months. So if your dog is vomiting too, I definitely would recommend withholding food for 6 to 12 hours. If he's still vomiting, even with withholding food and with a bland diet, then you need to bring him into the vet. If the diarrhea is very watery, or if there's a lot of diarrhea, or if the diarrhea is very bloody, then also you should bring the dog in. Some diarrhea cases of just simple diarrhea may have a few spots of blood in the feces, which can be normal for diarrhea in dogs. If it's more than just a few spots of blood, then definitely you need to bring your dog in. Finally, if your dog is showing signs of vomiting or not eating or appears very sick and dull, then please do bring your dog in. So there are many causes of diarrhea. In most simple cases, we don't need to do more investigation because normally the dog will get better on their own. It may just be something that they've picked up or something that they've eaten. However, if the diarrhea is not going away or if it's very serious, we may recommend to do further testing. Blood tests may be recommended. The vet may ask you to bring a fecal sample in so that we can send it off to the lab to see if there's any parasites in the feces. Also, sometimes we recommend to do a food trial in case an allergy is suspected towards a food substance. Finally, the vet may recommend to do abdominal imaging. This may include x-rays or ultrasound to make sure there's nothing more serious in the abdomen that could be causing the diarrhea.